Hi Doc, here we are at the last teaching video in this series. Hopefully by now you've made it most of the way through my book, and I've been putting a lot of the tools, information, and concepts we're discussing to work in your practice for you and your patient's benefit. As a reminder, in just a few days, you're going to receive a phone call from Mr. Dave Sonora, our practice development coordinator, to check on your progress with implementing what you've been reading in the book, to talk about the dental R-Factor exercises you completed back in video 3, and to see if you have questions about what I've been teaching. I'm going to send you an email reminder that I'd appreciate you printing out and handing to your receptionist so she knows that you're expecting Dave's call, since you really don't want to miss out on the opportunity to personally talk to him. Now, the last topic of this series, and frankly the most important teaching video of the entire series, is a review of how you go about designing an ethical selling system for your advanced services so that you predictably get acceptable levels of case acceptance on your larger treatment plans, be they from patients already in your practice or from new patients who come to you via marketing or referrals. This process is the real make or break factor for any advanced trained dentist wanting to put their skills to use on an ongoing basis. Unfortunately, too many in our profession, including those with the most clinical training and accolades, doctors with fellowships, diplomats, and board certifications, choose to sell their services in a random fashion, simply out of ignorance of not knowing that there are actual systems for selling everything, including our advanced dental services. Would you like to know some differences in outcomes between these practices that systematically and ethically sell their services versus those who don't? Well, for any practice not being systematic about this, here are 5 things that I can guarantee are happening that are unnecessary and could be prevented. The very first thing, fewer cases are going to go into treatment as a consequence of this. The second thing, less ideal treatment is going to be selected. The third thing, less compensation for you and your team's skill, caring, and judgment. Number 4, more wasted marketing dollars. And number 5, but not least, less professional satisfaction. In one of our other teaching videos that you may have already attended, I spent some time talking about the 3 most important questions you'll ever have at the end of your career, which are, did I love, did I live, and did I matter? And the reality is those dentists who systematically sell are automatically better equipped to be able to say yes to those questions at the end of their careers. Yes, I know, that's not a soft concept, but hey, we're all on a journey, and these kinds of decisions, like ethical selling, make a big difference in your growth on that journey. Okay, so let's move on to our review of a systematically designed sales process for complex cases. By the way, once we're through with this review, I'm also going to give you 3 of the most powerful things you can do right now that will start influencing your current sales process for the better. I care about you making progress in this so much that I'm willing to give you 3 concepts straight out of our programs, ranging in cost from $5,000 to over $115,000, and give them to you for free, if you promise that you'll report back your success related to these strategies to me and my team. Okay, so back to our flow chart of systematically and ethically selling advanced services. You'll notice there are a few items that are happening outside the practice, things including marketing and how patients contact your practice. If you aren't using marketing that gets interest from the specific types of patients you're skilled to treat, you're not systematically selling. If you aren't designing the structure of how phone calls are handled and what's said on the phone with patients with serious problems, you aren't systematically selling. If you notice from the flow sheet, systematic selling actually starts with the ads and all the information about you that's circulating outside of your practice in the marketplace, in addition to the first steps that create the first appointment. Now, once the patient schedules an appointment, a sequence of events starts to occur inside the practice. If you notice, there's a big triangle around these things that occur inside your practice, because those are the items you have the most control over and that you and your team have the most ability to influence and take actions that make a difference in how patients decide and what they decide. The purpose behind the first steps in any system for selling is to give patients a chance to qualify themselves on whether they're really ready for treatment. And as we go further into systematically selling, our focus becomes on giving patients the tools they need to decide on the best treatment options they can afford to invest in. These things are contained inside these things like red and blue packets of information, and they do a lot of work for what's happening inside this triangle. They're part of the sequential steps happening inside your practice. If you notice on the flow chart, there are different types of appointments. Things like free and low-cost visits, diagnostic visits, and all of these are in their own boxes. It's because there are critical things that happen with you and your staff and actions you take at each of these steps. You also notice in the presentation box, there are actually three things: pre-presentation, the presentation, and post-presentation. If you aren't thinking closely about what happens in each of these steps, with how people decide and buy, you aren't being systematic about selling. There are different types of information that patients simply inquiring about services and patients committing to consultations actually want to know about and receive from you. It's that reason why there are two types of packets again. A red packet and a blue packet that all of our member practices use. Of course, as we progress through these events, there are some things patients should be shown, some technology that's important, such as simulations, other technologies that don't matter, and things staff should do and can do to help patients make better decisions. Yes, how you and your staff talk and discuss treatment are also components of ethical and systematic selling. And all of these items must be built into this sequence of events. Sound complicated? Well, try to manage all of these things we've talked about today is complicated and basically impossible unless you put structure around it, and specifically a system documented with each step of what happens when. There even has to be a system for training and maintaining you and your staff skills for selling with your system. We all attend CE for both new information and for refreshing our clinical skills. Why would selling be any different? It's not. Needless to say, I can't teach you the entire process for ethical selling in this one short video, but there's no doubt that this overview has created more understanding. I do want to send you away from this video with three very practical things you can do right now to improve what happens in your current sales process, which from our experience working with dentists all over the world, undoubtedly contains a lot of very random events and actions. It's okay. You simply didn't know any better, but now you do. Again, these practical things are all straight from our ethical selling system and training program that we teach called the Maximum Case Acceptance System that every member uses in their practices. The first concept is related to something that you should not be doing with any patient or treatment plan involving significant amounts of dentistry. For our discussion, we'll say any treatment plan that's more than $5,000. This big no-no is the all-in-one appointment, the all-in-one consultation, diagnosis, and treatment plan, and fee presentation appointment. While there are a few rare circumstances where this makes sense, for the vast majority of situations, if you're doing all-in-one, I can guarantee you that you aren't getting as many patients selecting treatment or selecting the best treatment as you could be. You see, patients need time between appointments or how they decide on buying and purchasing, and you and your team need to time between appointments for covering and reviewing key details about each patient so that your acceptance rates aren't diminished. Stop the all-in-one appointment, and you'll automatically improve your results. Now, the second concept for you to put to use immediately is to use something at Big Case Marketing that we call fee framing. Frames are things that encircle and define either tangibles like paintings and art, or that help define and encompass a concept so that it's better understood and applied. Before you have another single discussion about cost for your advanced services, you must fee frame the procedure or the treatment plan the patient can expect to hear at the case presentation. You see, patients have no idea what significant amounts of dentistry can cost, and honestly, they shouldn't. It's not something they buy every week or even every year. And if you don't give them the tools to understand what costs can entail, you're discussing treatment with many patients who really aren't ready to have those kinds of discussions. Fee framing is appropriate to do on your website. Materials patients receive from the practice, such as in your version of the red and blue packets at consultations, diagnostics, and even just before you give the actual options of treatment plans. Use fee framing to help your patients get a grasp of what they can expect to pay for your services, and you'll automatically get better results. Now, the final concept that I want to review, straight from our member programs that I want to share with you today, is one involving the presentation of options as well as the presentation of cost. Behavioral studies have shown again and again that the best way to present options so that people make the best decisions possible is the best option is always discussed first, followed by other less optimal options. In most circumstances, this also means that treatment costs will also be presented first, from most costly to less costly. If you're presenting least optimum and least costly first, and most optimum and most costly last, your patients are guaranteed to be choosing less ideal treatment plans than what they would do if the events were ordered in the correct sequence. So present these options correctly, and more patients will choose better treatment. Okay, this just about wraps up our discussion about designing an ethical system for selling for practices that offer advanced services. As a reminder, the three things I discussed today are just a few of the hundreds of details that truly make up a systematic selling system. Do your patients a favor and either take the time to research and develop a well-thought-out sequential process for selling based on the behavioral data that we all have access to, or simply skip all of that work and go out and invest in a system that's already designed, tested, and proven, and installed. Anything less, especially if you have a lot of clinical training, is simply not operating at the level of professional ethics that you should be at. And without it, you're not doing yourself or your patients any favors. So, here we are at the end of our teaching series. As mentioned earlier, be sure and let your receptionist know that Dave Senor will be calling your office to set up a personal time to check in with you about this teaching series and answer any questions about things that might have been unclear. Print out the reminder email and tape it by the front desk phone. Now, I hope you've had as much enjoyment being exposed to the concepts in this teaching series as I have had in covering them with you. You know, it took 18 years of my life to be ready to hand this over to you for your success. So don't stress if things aren't perfect overnight. One of the mentors you heard me mention earlier, Dan Sullivan, has a great saying: focus on progress, not perfection, which is what I encourage you to do too. Congratulations is also in order, as for many doctors, these videos are literally their first step towards moving to getting more of the cases they wanted, helping more patients that really needed them, and having more of the dream practice they've always wanted. The videos may very well be your first step with all of those things too. Now, if you do find that you're ready to move beyond these concepts, even more advanced ones, I'd absolutely love and adore sharing those with you via one of our structured programs. As always, wishing you the very best in health and success.